And hi, everyone. TJ Aulds, I-45 now and Pod Now with another edition of Healthcare Unmasked. Welcome back at our first live show of 2024. Glad to have you along here. We got some special guests with us here today to be talking about the future of nursing from UTMB. And I'm always biased. I always bring this up when I do shows like this, that I always want to get over here to talk about nursing all the time. And joining us here today, we have Dr. Ainslie Nibert, who's here with us. She is the department chair for graduate studies at the School of Nursing, and the world famous Dr. Deborah Jones, the vice president, the senior VP, I should say, and the dean, the School of Nursing. And thank y'all both for being on with us here today.
Absolutely,
thank you.
Yeah, we've been talking about this show for a while, actually, and excitement. And one of the things where we have some exciting news. That was released a few weeks ago is that maybe a lot of people don't realize about the nursing program at UTMB, the nursing school at UTMB, is it has one of the top online programs anywhere. I'm going to have you get a little closer to your mic here, Dr. Jones, but talk about that recognition, because in this day and age on education, we think about nursing school that you're in person, and the like, but and really there's a lot of the online element that's taking place. So talk about that recognition, how it came about.
Right. Thank you, TJ. First, thank you so much for having us on here. We are extremely excited to talk about nursing, even more excited to talk about UTMB nursing, because
right.
Of course we are the best. And I think this ranking is one of the areas that helps to highlight that. So we have been doing online graduate education for 26 years. We were the first in Texas to have an online graduate program, our master's program. And so we've kind of figured it out, right? We figured out how to do it very well. And we're very fortunate now to have the national rankings that help to show that and showcase that. Those rankings came about because U.S. News and World Report, as you know, they're nationally. They look at over 1,800 schools of nursing across the nation online that offer online graduate programs. And these rankings are ways to determine, they look at things like the faculty credentials. So our faculty have doctorate degrees or master's degrees. They look at our student to debt ratio. So the students leave with debt and how much debt they look at. They look at reputation, of course. How well are we known? The other schools of nursing deans get to weigh in on the rankings, which right. I think says a lot as well. So there are a number of factors that go into the rankings, and it makes us proud. I mean, our faculty and our students have done quite a bit to continue to make sure that UTMB is on top. I'm honored to be here to talk about it.
And Dr. Nibert, one of the things when you were talking about the history of this, and this is the thing that fascinates me so much about UTMB, that I think a lot of folks don't catch on to. As a matter of fact, is the technology side of things driven? Mm-hmm. I mean, most people would say, oh, we didn't have online courses until COVID came around. Mm-hmm. Not true. I mean, it's been around. Talk about how that is enhanced, how the online studies have enhanced the education that UTMB offers in the graduate side.
Absolutely. I think when you think about a busy nursing professional, it is indeed quite an honor for us to even welcome busy RNs into our graduate program. So we'll start there and say, given the kind of conditions many of our RNs are working in, both prior and during COVID and after, they really have to have some dedication to further their education. At UTMB, we are delighted in the School of Nursing to offer them lifelong learning. And one of the ways that we find in speaking with our alumni and with their employers is that flexibility is key. So if we can provide both synchronous and asynchronous types of education online, meaning, the students do meet with faculty over video conferencing, such as this that we use all the time now, and they meet with them asynchronously in the sense that faculty have prepared materials for them that they can review anywhere, anytime. It really lends to an environment where they get the education they need, but on their terms, the time that they need. And I think that's what's really made this a huge improvement for all of us.
And for folks that are looking at our screen right now, they're seeing video of like they're doing a sim baby simulation here right now. And that's the hands-on side of things. So explain how the online program works, because I think a lot of folks will hear, well, how's that? This is for the graduate side of things.
Right.
We should point out you've done all of the hands-on and everything else. When you go into the online things, what are those? What's the emphasis there that the online studies really emphasize and help out with there?
Well, I think the online component, as I said, the faculty will build modular education. So topics that are very relevant to practice. And it's not a lot of dry facts, frankly. It's how do you manage this situation? What are the things that should go through your mind in this type of an emergency? What are the things I need to be asking patients about in order to figure out what is their greatest need right now? What problem should we be addressing? So we build those skills through the online environment. And then we encourage students as they're in their daily practice as RNs to then think about how is this playing out in their practice right this minute. So you can certainly bring them into our state-of-the-art simulation environment. We can do intensives over a 1 or 2 day period where we have our students here on the island at the UTMB campus and refine skills that will be new to them that they need to master in order to graduate from the program. So it's a great combination.
When you said it was 27 years, Dr. Jones, that this program has been around, talk about the differences 27 years ago. Now, I mean, it was 27 years ago, we didn't have the internet like it is. It was almost like dial-up or satellite at that point.
Yeah, absolutely. And I think that speaks so well to what UTMB, how innovative UTMB is. Of course, I was not around at the time when it began. So to speak exactly how we did the online version of it, it certainly was different. Now we have, as Dr. Nibert said, we have state-of-the-art equipment to be able to do that. We use iPads actually to do a lot of our teaching online, the desktop, of course. Our students, we can even do virtual site visits. So sending iPads out to our students are within a clinical setting. Our faculty are, at their desk and able to connect with the students and see them doing a full assessment of their patient. We bring them in, as Dr. Nibert also mentioned, to our state-of-the-art health education center where they do hands-on practice of a lot of these skills. Because of course, let's face it, nursing is absolutely a hands-on profession. These advanced practice nurses have gone through the undergraduate program primarily face-to-face. And then when they're in this online program too, they still get the opportunity to practice within our simulated setting. And then of course in their clinical courses. So it really has been a great marriage of the two. Mm-hmm. And our faculty have learned how to do this in a way that does not at all skirt on quality. Our students graduate and are able to pass their licensure exams and do very well and provide high quality education.
And in fact, one of those folks that benefited from that high quality education is joining us now. It's Diana Macheris. And Diana, you just wrapped. By the way, congratulations! You just graduated in December, correct?
Yes, I did.
I'm sorry, Diana. There you go. Now we can hear you. You just graduated in December, right?
Correct.
And you took the online course. What for you was the benefit of those online courses?
There were a lot of benefits, but mostly being able to pursue my degree remotely allowed me to maintain a balance between my academic pursuits, professional responsibilities, and personal commitments. The online environment fostered a strong sense of community and collaboration among students and faculty. So we had, like I mentioned, virtual discussions, group projects, and online forums. And I was able to engage in meaningful interactions and exchange ideas with individuals with diverse backgrounds and geographic locations.
Now, did you do your general studies at UTMB for nursing as well before the graduate program?
No, actually, I am from Austin, Texas. So I first attended the Austin Community College and obtained my Associate of Science there. Then I transferred to the University of Texas at Tyler, and that is where I graduated with my Bachelor of Science in Nursing.
So were you in Tyler at that time and then taking the courses online from UTMB in Galveston?
So I received my bachelor's degree first. I've been a nurse, a registered nurse for 7 years at the inpatient setting. And about 5 years into my nursing career, I decided to pursue the online master's degree program.
And that's what I was going to ask is where were you at when you found out about this program and said, oh, here's a way I can get my master's and stay where I am and continue working?
Sure. I actually had a work colleague of mine recommend UTMB program. He completed the same program around 2021 amidst the COVID pandemic. And he had nothing but positive things to say about the program. So I had already kind of toyed with the idea of going back to school. So that's what prompted me to look into their online program.
How easy was it for you to sign up?
Yes.
No, how easy was it, I should say?
Oh, how easy. It was very straightforward. Very straightforward. The application process was fast. I received a response pretty quickly.
Oh, that's great. Now, the course studies, were you able to kind of set it to your schedule, or were there already set times? How did that work for you?
The course studies, my schedule was set by someone in the faculty within the UTMB School of Nursing. And it was pretty straightforward. It was about 2 or 3 classes a semester. So accommodating us as part-time and being able to handle our jobs as well. But we basically had a schedule all 2 years of my master's degree program.
And now you've been able to get that master's degree. What are you doing with it?
Well, I finally got my diploma, and right now I am studying for my licensure exam. So hopefully within the next month, I should be taking that. And once I receive my licensure, I'll start looking for jobs.
And then that's great. And Diana, thanks. I know you've got to be somewhere at 1, and we don't want to hold you up from there. But thanks for giving us a student perspective. I have to ask you though, were you intimidated? Had you taken online courses of any type beforehand? Were you intimidated at all to sign up for this?
Oh, absolutely. I am a very hands-on type of person. I love to learn in the environment. So online was very intimidating to me. I knew it would require a lot of just being responsible with my own time, a lot of just kind of doing everything on my own. So it was very intimidating, but the faculty was very involved, very prompt with responding to us, with letting us know about deadlines, and they made the process very, very easy.
Diana, thanks a lot for joining us here today. That's going to be fun for you two to hear the success story and see it in person here, with someone who went through the program, who found out about it and is continuing her career. That's got to be something really exciting for you guys.
Absolutely. I mean, because that's what it's about. That is absolutely what it's about. It's about being able to provide quality education that students can access, that's flexible from different areas so we can reach a broad number. And then when they graduate, that they feel like they have not missed anything by attending a program that has the hybrid, primarily the didactic courses online. And the fact that she'll get out, she'll practice, she'll finish her certification exams and, stay hopefully here in Texas. Graduation, I can tell you, is probably the most exciting time of the year, particularly for me as a dean, because it does remind you of what we're doing it for. We're doing it to help produce nurses that are willing to go out into our community and help to provide that high quality care that all of us will need one day and need every day.
Hey, Diana, I forgot to ask you though, did you graduate virtually too? Did you come on down here and put on, I guess they still do the not the cap and gown so much. They do the whole nurses outfits, the hats. I call them the Florence Nightingale hats, but did you come down here in person for that?
They gave us the option. We could attend, and that commencement ceremony would be in April. So we would have to come back in April. So we just kind of did a little get together between the students and the faculty and just kind of celebrate us.
So we're going to see you here in April.
God willing.
All right. Diana, thanks for coming on with us. We appreciate it. Thanks for giving us perspective of a student going through that graduate program online. And you're one of the success stories, obviously, from there, too. So thanks for joining on with us today.
Thank you so much for having me, TJ. All
right, Diana. Thanks you so much. And recent graduate, and as I said, in December where she graduated. Dr. Nibert, I got to ask you, though, what's the success rate of folks taking this online course? Because you heard Diana say, it can be intimidating. And sometimes when you get those intimidating formats, but what's kind of What's the kind of percentage rate of who starts and who finishes up?
Yes, I mean, especially at the graduate level, it is challenging. We know that graduate students have a lot of varied responsibilities. Many of them have families, jobs, et cetera, just like Diana was talking about. But the good news is most of our students indeed persevere all the way through the completion of the program. And then what we're really proud of is they complete that certification exam that Diana was talking about studying for right now. And these are national exams that are offered in their areas of specialty. And our graduates go on and complete those at a very high rate. So the good news is they get through the program, they get through their certification exam, and as Dr. Jones said, they will move into employment, which is so important in the state of Texas when we have so many areas of our state that don't have healthcare providers at the advanced level. So what Diana will be able to do is see patients, write prescriptions, follow up when they move into long-term care facilities from an acute care facility. So there's a lot of real importance here in getting our folks through graduation and certification and out in the employment field.
The other side of it, though, too, is that you heard from Diana, she didn't attend UTMB and got to go to the graduate program. That's a big recruiting tool for this program, is it not?
Absolutely. Yeah, absolutely. Yes. The access across the state and across the nation, actually. We can have students in most states across the nation. And so we get applicants from all over, and they can do it from all over. Now, again, they do have some opportunity to come on campus, but it's so very flexible, and they know those states well in advance.
And then they can make the trip. And who wants to not come down to Galveston?
That's
have
right.
some time, take a couple of classes, go out to the beach, and have a good time. If you time it right, come during Mardi Gras or something like that.
Right.
Yeah, have a really good time. It's so exciting to be talking about the online thing, but there's so much that the School of Nursing is accomplishing right now, and its advancement out there. And we're going to talk about the future of nursing and what's to come in this. Online is one thing, but there's a workforce that's got to get filled, and they're working diligently on that. And if you've ever thought about, hey, you know what, I'd like to see what it'd be like to get in the medical profession, we've got some stuff to be talking to you about too, and that's coming up right after these words from UTMB Health.
There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor, UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/women's.
And welcome back to UTMB Health's Healthcare Unmasked, presented by UTMB Health here on I-45 Now and Pod Now. And one of the things we didn't talk about earlier on here is while top ranked in the online and on the general studies, but also in veterans too, and a very important part of that. Talk about that side of things too, because I was at a meeting this morning with a workforce committee that I'm part of here for Galveston County, and we were talking about recruiting of veterans getting into the workforce. Talk about how veterans can accomplish through the programs here, particularly that online program, because it's also top ranked in the nation too here, right?
That's right. Yeah, we're number 4 in the nation for veterans, and this is actually the second consecutive year that we've had that ranking. And we're very, for our graduate program, we're very, very proud of that. Veterans, as everyone know, we want to make sure that for them to be able to receive education, that it should be seamless. It should be a pathway. And that's what this provides. The rankings only highlight the fact that we recognize the benefits of the veterans, and we are allow them to be able to use those benefits to come into our program. Only schools of nursing who have ranked in the top 50th percentile are even included and looked at for veterans rankings. And you have to have a certain number of veterans to even qualify for that. And so we're absolutely proud of that designation. We certainly want to make sure we continue to offer programs to our veterans and to partner with organizations that have veterans. We're looking forward to doing that more and more to figure out ways that we can continue to make this a program that is one of choice for our veterans.
And how is the recruiting done to get the veterans into the program?
It's primarily highlighting those things, highlighting that we do recognize the benefits, that UTMB as an organization do recognize and provide opportunities for them to use their benefits, such as the GI Bill. We make sure that it's clearly stated in all of our recruitment materials. We make sure it's on our websites, not only, like I said, the School of Nursing, but UTMB in general. We're very fortunate and friendly towards making sure that veterans are recognized and know that there is a place for them at our institution. And so we put it in all of our marketing materials. We have a student recruiter who goes out, and make sure that to provide that information moving forward.
And one of the things too, when you got that recruiting the vets, a lot of times you're getting different experiences coming in. What are the resources available for those veterans when they get into the program here that go beyond just the educational thing? Because a lot of times with veterans, you need to take those extra steps because of their service before they come in.
Yeah, UTMB itself has resources for veterans. We have employee resource groups that actually there is a veterans resource group here. We have groups that they're able to interact with each other and make sure that there are opportunities available. And so the entire institution actually has put a foot forward to make sure that there are opportunities for our veterans that not only include education, but also employment opportunities and career fairs that are sometimes even geared towards recognizing if it's a position that a veteran would have a high priority for that position. So we definitely put efforts into ensuring that there are opportunities and that those are known across our institution.
All right. And as I said, when we come back, we're going to be talking about just nursing overall and recruiting. We need more nurses. There's no doubt about it. And we're going to be talking about the workforce here coming up after these words from UTMB Health.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB health specialist near you, visit UTMB. UTMB knows that good joint and bone health is the key to a pain-free and active lifestyle. UTMB Health Orthopedics specializes in providing innovative care for common and advanced orthopedic issues, including sports injuries and total joint replacement. UTMB knows orthopedics. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com/ortho. There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com. There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com. UTMB knows when you're expecting, you may not know exactly what to expect. From that first embrace to all the milestones that follow, we know how important each stage of life is. That's why UTMB Health's obstetrics and gynecology physicians specialize in innovative women's health care through all phases of life. UTMB knows women's health. UTMB knows you. To find an OBGYN specialist near you, visit utmbhealth.com/. There's nothing more important than quality health care for you and your family. That's why UTMB Health is in the communities where you live, providing easy access to innovative care. At UTMB, we know our patients need personalized care to lead healthy and fulfilling lives, providing everything from primary care and specialty care to urgent care and emergency medicine. UTMB knows healthcare. UTMB knows you. To find a UTMB doctor near you, visit utmbhealth.com.
Here we go. Sorry about that, folks. We had a bit of a audio and video glitch there. We lost connection to our board there. Now we're back here on a Healthcare Unmasked presented by UTMB Health. And as I said before we cut away, we're talking about nursing in general, filling that workforce. And we had an interesting conversation last week about this. And Dr. Nibert, you brought it up about where we are in the nursing workforce nationwide. And I wonder if you could touch on that right now.
Yeah, there are clearly shortages of nurses at all levels, both the RNs that are working commonly in hospitals as well as in clinics. But we see this acutely in particularly rural counties outside of metro areas where we really have a lack of qualified health professionals to treat people that live in those areas. So one of the things that UTMB School of Nursing has been very innovative in doing is establishing a rural telehealth certificate. And that will enable, typically RNs, we start there, we say, what do you need in order to function in a telehealth environment? Because those have been methods through the technology of reaching patients that can't easily get to a healthcare provider. So we offer a 3-semester program. It can be finished in a 12-month period, really teaches how to use telehealth to the greatest advantage and give a lot of hands-on type of experience with it. And what we find is that particularly for nurses that are focused on treating patients that live in rural areas, this can be really a way to expand both their practice, but importantly, it can help expand this workforce situation by using many, many skills that they have.
And now that you bring it up on there, Dr. Jones, I wonder if you can touch on this a little bit, is that when we talk about workforce, we're looking at it as a nationwide thing. Let me break it down first. In the metropolitan areas that are in the Houston area, New York, Boston, wherever, is there a shortage of nursing there, and also a shortage on the way coming as well?
Right. Yeah, no, I'm glad you brought that up, TJ, because there are geographical differences. You will hear the globally, there's a nursing shortage, period. When you go to geographical areas like the metro areas, there is less of a shortage notice because of many of our new graduates, particularly when they go to practice, they practice within those metro areas. Like Dr. Nibert mentioned, it's the rural counties where you don't see a lot of our students, and I'm not talking specifically to UTMB, I'm talking about overall nursing students go to the rural areas, which is why programs like the Rural Telehealth Certificate or programs that offer to fund students who come, practitioners who come into the rural areas and practice are necessary and needed. I would also mention not only is there the nursing shortage itself, but there's a nursing faculty shortage, which contributes to this nursing shortage. And this, in the last 10 years, this is the first time we've seen such a large shortage of nursing faculty, that it has continued to increase. And that's because, our faculty on average they're aging. There's an aging population of the nursing workforce itself. There's also some parity when it comes to payment for or compensation for faculty. It's less than if you were to practice in a clinical setting. And so we're really trying to combat both things, trying to make sure that we are producing nurses to go out and practice, but also producing nurses who are going to come back and teach and become educators for us. So that's why the graduate program as well as the undergraduate program are both vital to be able to combat the shortage that's here. So,
because you had the brain drain on the faculty side of things, and then you're also trying to recruit in. Is it one of those things that I know with some educational institutions say an adjunct, but Is it one of those things you're going to have to go into those clinical settings and say, hey, we'd like you to also teach at the same time? It's just really going to have to kind of balance that out instead of just hiring someone full time just to fill the gap for right now.
Absolutely. I mean, we have to open up our models there to have also welcome part-time faculty, welcome partnerships with our practice partners, where that there could be faculty in the health system that also are a part of the schools of nursing, and that we partner to jointly appoint those people so that they can see students in the clinical. It's one avenue that can be taken to try to fulfill the need, but it is a time that nursing has to think outside of the box in terms of how we're going to meet this shortage. And I think we've been trying to do a lot of that globally. When I think about nursing across board, many of the schools and deans of nursing come together and talk about and focus on how can we do this together? What is it that we can do? I apologize. What is it that we can do together?
No, we don't have a baby module in here. That was Dr. Jones's phone. That's all right. So I was like looking around. I thought I was like, no, go back to what I know you lost track there, but yeah. It's your mom calling you. Okay,
No,
sorry. She's going to call you back. Oh, your alarm. Sorry.
Yes.
I thought you said your mom calling you. I was like, she's going to call you back. No, but
Yeah.
if you know what you were saying here is that globally you're making those efforts.
Right.
What's being done on the kind of more local, regional, statewide right now?
And if I can start with what's being done, if I can even start with the fact that Texas itself, we're also facing a shortage, and even more so than some of the other states, not because we're not producing as many nurses, but the population in Texas is growing. Everyone wants to move to our great state, right? And so we're going to have to be able to take care of all of those people, and that also impacts the shortage of nursing and the future of nursing for moving forward. So some of the things that are being done, certainly on our end, with the ability to offer more flexible programs. Our school is also offering scholarship programs to students to get more students enticed to come into the program. And these are through co-curricular options. So we have honors program students who can come in and they will immediately be able to, in their second semester, enter into one of 3 tracks. They would get extra training around policy and leadership, or they'd get extra training around advocacy, particularly around women's health, or around research and quality improvement. And through those programs, they get additional scholarship money and scholarship funding that, so it becomes very attractive for them to think about coming into our program. We are offering other avenues and ways to be able to impact this, particularly around our nursing faculty shortage. What we're doing is trying to be a bit more flexible in terms of where the faculty work. That's something that really prior to COVID hadn't been something that we've explored before. But many schools of nursing, many institutions itself have to look about the flexible work arrangements to be able to allow people to, kind of be a bit more flexible in their time and a bit more in control of their time for their work-life balance.
Yeah, and that's, I think, something we're learning in the workforce overall, not in every field right now. As I said, I was at a workforce meeting this morning. It's like, how do you recruit people? Well, their attitudes to work in the days. Obviously, we already knew folks have staying 35 years with a company or with an institution. Those have gone by the wayside as well. But also, they want to have more balance. As I had said, COVID, I think, reset us in so many ways. One of the ways it gave people a chance to look. I've been running this rat race for a while. I'm not so sure I want to chase it that way. I still like to do what I do. We were looking at video here when they were doing the sim baby here. In pediatrics, every nurse that I know that loves in pediatrics or NICU units and stuff, they have a great passion for that. But after a while, the grind gets to them, and they're like, "Hey, I need to take some time off." And I have noticed too is that we're finding now this goes on the other side of things, but the institutions are learning of, all right, you may work fewer days, more like a firefighter where you work 3 days on, 3 days off, that type of thing too. And I would think too, in the educational side of things, you're looking at, okay, how do we also balance that? So you realize there's something beyond here. Is that a fair
Yes,
thing
I
to
would
say?
say, from the graduate programs perspective, we, as I said, want lifelong learners, and that really starts at the undergraduate level. So as Dr. Jones said, we really start at the earliest stages with students in our baccalaureate program to talk about career advancement. What are you going to look at nursing in 10 years? What are you going to look at in 20 years? What kinds of things could you be doing? And that leads some interesting conversations. They can see faculty in action who have their doctoral degrees. We explain what might be part of that progression. a Doctor of Nursing practice degree or a PhD in nursing, and what are the different things that you can do with those degrees. So I agree with you that nurses love what they do in many cases, but they also have to have in the back of their mind, what could I do next? What else could I be doing beyond what I'm doing today? And I think that the options for these kinds of graduate programs to be online, particularly the DNP or the PhD, make it suddenly attainable. I may not have seen myself, for example, as a nurse with a doctorate degree, but now I could actually envision that and fit it into my life with everything else that's going on.
And we just heard that from Diana here too. I mean, while it was the master's side of thing, she had been in the workforce for 5 years before she said, okay, I'm going to go do this now. And as I said, I had taken that where, I was thinking the whole kind of, all right, you've done this, and you go right away into that graduate side. That's not the case anymore. We're finding more and more there's that gap between going into the workforce and then coming back for their master's or doctorate, correct?
Sometimes that happens, and sometimes it's simply not being able to envision, how can I make all of this work? So that's one of the reasons that I think these examples of certificate programs are so helpful, because if I'm not real sure I can make that commitment to complete a degree, for example, that might take 3 years part-time or 2 years part-time, one of the ways that I can test the waters, so to speak, is to go out, try 1 or 2 of these courses, 3 or 4 of these courses, ultimately receive that certificate so that I get the skills that I need and some of the acknowledgement of my work. But then I can prove to myself, gosh, I can do this. And we will accept those credits as graduate level credits, of course, and move on and accept them into part of the requirements for the other degrees.
And that certificate program, we talked about that some, and you mentioned it earlier too, for example, the telehealth certificate that comes in. Again, somebody doesn't have to be a UTMB student can come in and get that. What are some of the other certificate programs that are available that particularly in the School of Nursing?
In the School of Nursing,
right.
On the graduate side, we have a certificate for nurse practitioners who are already practicing in one specialty, for example, as family nurse practitioners who want to expand their skills to include adult gerontology acute care patients. And so we will put them through a certificate just for that acute care experience. The other certificate we offer is in nursing education. And this goes back to what Dr. Jones said, that we have such a nursing faculty shortage, particularly getting probably worse, not better, as people retire. And we look for a new generation of nursing faculty to come in. So we have a nurse educator certificate that will prepare individuals for the certified nurse educator exam. And then that may be some mobility for them to start teaching.
And the nurse practitioner side of things, we hear more and more now where communities that particularly those rural communities or smaller communities or underserved demographic communities where nurse practitioners are coming in instead of doctors, and at least getting to a level of care for the general health care. And that's something that can be done that a lot of folks may not realize.
Yeah, I think certainly when you think about those rural areas, so we also have a shortage of primary care physicians, across the nation. So if you think about those rural areas that need all of these providers to work together, we actually have developed a FNP, family nurse practitioner, and acute care nurse practitioner dual certificate program or dual degree program. So what that means is students can enter into our School of Nursing. They have integrated classes around family, primary care, as well as acute nursing care. And when they graduate, they're able to sit for both certification exams. And that way, if they want to go out to a rural area and practice, they can follow their patient from the clinic into the hospital if it turns that way, where their person has to go into the hospital. And so that helps to meet a lot of those rural needs. And we just started that program in the fall of last year. We have quite a few students already involved in it. We're the only one in Texas who have that program. And so it is certainly one that I think will help meet some of these needs across the rural area.
And when we talk about rural area, by the way, folks, it's not too far. I mean, we're talking in Galveston County, yes, where we're sitting, but where UTMB serves just over the way in Brazoria County, outside of a couple of the cities, you're in rural area right there. When you get to other parts of it, a lot of people don't realize this about UTMB Health, but I always find fascinating is the service area that UTMB has across the state of Texas, big swaths of rural areas. So there's not only, when you're filling a need through the education side of things, but you also know firsthand what that demand is from the own institutions that are aligned with UTMB that are out there that need that help.
That's right. Very true. And it's certainly for us to be able to collaborate and partner with them to figure out ways that we can help to meet the need has been rewarding for us. And it's one thing that we try to do. So when we look at new programs and start new programs, we really start with what is the market need? What is the need out there? How can we help to fulfill it? Do we have the expertise and the ability to be able to do that? And that's how we decide on launching new programs. We've done the same with one program that just opened. Applications just opened this month, our nurse anesthesia program. And so we went through going through accreditation for that, and we just received that in January. Our applications opened the end of January, actually, with already applicants in place. So that too is another area that there is a need across the state and a need globally. And even with our own hospital, we really feel like this can be a pipeline for CRNAs working within our own healthcare system. We're very excited about that too.
And not to knock the anesthesiologist or anything like that, but as somebody who's been on the operating table a lot, I can tell you that the anesthesiologist, I see him write it, or him or her, like write it early on, but it's actually the nurse, the anesthesiologist nurse that I talk to the most time. The one also I always like to say that picks the music for the room into, but you know, that's who you're dealing with. That's the kind of the frontline worker that's there in those positions, and having that specialty, having that available is an important part, as you said, to fill in gaps, to shore that up. Now it comes into how do we get folks in the door? I mean, I'm sure there's some folks wondering right now, so, it's going to be too hard. Obviously you got to do it, put in the work to get there. But when we come back after this break, I want to talk about what efforts are there and what does it really take to become a nurse in this day and age, within the settings and with the challenges are there. And we'll be doing that when we come back right after these words from UTMB.
UTMB Health knows that when you need advanced surgical care, you want a specialist who's an expert in their field. Our surgeons provide innovative and advanced treatment options for adults and children, for neurosurgery, GI, heart surgery, ENT, urology, and more. UTMB knows surgical care. UTMB knows you. To find a UTMB Health specialist near you, visit utmbhealth.com.
And welcome back to UTMB's Healthcare Unmasked. I'm TJ Aulds here on I-45 now and Pod Now. And before we went into the break, we were talking about, we can talk about need and how efforts are trying to fill that. But if you can't get the folks in the room, it's not going to do a whole lot of good there, or online, as we were talking earlier. What, I think sometimes my wife, who is a college vice president, tells me all the time a line that I like to repeat a lot. This is the bravest thing a student could do is open the door when they pull the car into the parking lot. That once they get out of that car and start walking into the building, that's the bravest thing that they can do. It's then up to the institution to make them feel welcome and take him from there. So it can be a daunting task, because it is a lot of studies. And we're used to seeing, if you watch Grey's Anatomy, you think everybody's overworked. And, there are only two things they're doing. They're working or making out. That's the only thing on that show that happened. But I'm just saying, though, is that you just see the grind. And it's always, and yes, there is going to be a grind there. But what does it take admissions wise? What is it going to take if someone wants to get into the field of nursing? And not just UTMB, there's, right where we're sitting right now, as I said, UTMB, Galveston College, College of the Mainland, San Jacinto, University of Houston, Clear Lake. I mean, everywhere we turn, we have a nursing school somewhere around here. But, it just to kind of demystify what we need to about admissions and what it takes, and then what the studies are like nowadays.
I'll start, and then Ainslie can jump in, because I want to underscore what your wife said. Absolutely. That is truly the case. We actually work with Higher Up Texas, which is one of the partnerships that we have. It's with the Dickinson High School and Mark High School, where our students actually serve as mentors to the high school students. And every semester they are with these group of students who may or may not even know how to get into healthcare, to get into the next phase of college. And what our students do are show them that it is attainable. It is feasible. Yeah. And these are the steps that I took. And it was just a year ago that I was sitting in your space. And I know that the executive director said one time that many of the students, they would say that they saw UTMB, familiar with UTMB, but only as buildings. So those are buildings over there. Didn't necessarily see themselves within these buildings until after some of this experience that they've now had with our students and coming on our campus and visiting. So they see it as an opportunity for growth, and we do too. So it is absolutely attainable. I would not at all lie and say it's not a rigorous program,
Right.
Because it is,
Right.
and it should be.
It should
be. But it's certainly open for people who are ready to go into it. We provide a lot of information and as to how to apply to our programs. We provide, once they are in the doors, we have tutoring that are available to our students. We have mentor programs, peer-to-peer mentoring programs that are available to our students. So we make sure that we have the resources available for them to be successful. And I always tell the new students when they start. So when I meet them at orientation, I say to them, yes, you picked us because you realize we have a great reputation. Our NCLEX pass rates are well above national ranking. You may have recognized that we have this health education center. You may have recognized that we have dedicated faculty. And you're right. And we will provide resources to you to be able to make sure you're successful. But it is a two-way street. And so when you come into the door, what we require of you is to take advantage of the resources. Ask us the questions. Recognize that when you're here to learn, you should be a sponge, and nothing is a silly question to ask.
Right.
And so I think certainly we try to make sure that it's welcoming for them from day one that they come into our doors.
I think also one of the things that, again, full disclosure, folks, and both Dr. Jones and Ainslie know this, that my aunt is a professor, here at the School of Nursing, the graduate study side. But, having grown up with a nursing professor in my family, I've grown up with, not grown up, but I'm insulting by saying growing up with her. But being married to my wife, who's a college VP, who's always had schools of nursing, and it gets into that it is a program, but it's a rewarding program. And we can say it's rewarding all we want, but you do have to, got to get into those doors. You got it there. I wonder though too is I bring this up only, and I know that I'm putting y'all on the spot with this, and this is overall it's an affordable program, but I'm just saying we just saw, for example, $1 billion donation to this school, the Einstein School of Medicine, $1 billion paying for everyone's tuition. We're seeing that more and more, and there's more of a national movement. The cost factor, I think, is coming into play more so now. We used to talk about it was always in the doctor's side of things, but in nursing too, when you've got a family to raise and it's costing more to live, that you I can go to this or I could do this. I got to make some money. What are some of the resources that are available at UTMB, particularly to help on student aid and the like too, to help on financial help with things as folks come here?
Yeah, we have scholarships. I mentioned some of the co-curricular opportunities once they come in. That's additional payment for the students to be able to be in our program, a honors program. But of course, we also have scholarships for our students to be able to help support them through the program once they start, continue to go through the program. And in UTMB itself, we just started a CNA. We're in the second semester of starting a CNA apprenticeship program. We also have a couple of other apprenticeship programs through MRI and surgical tech. So that means these students come into, we're partnered with Galveston College on at least the MRI program. And so they come in and they're taking their courses to become a certified nursing assistant, taking their courses to become an MRI tech. And at the same time, they're working and getting paid while they're doing this. And their apprenticeship model allows these people to have an introduction into education, to start into education while also getting paid so that they can do just that, support their family. And then guess what the next step is? They will generally go on to another degree. The CNA students may generally go on to become a registered nurse, go on to become a nurse practitioner, because we've opened the door for them to be able to do that. And so I think that's one of the programs that we offer that allows a bit more funding as well to our students to make it possible. Now, I will mention, TJ, though, we are, every program, no matter what, I don't want to say that it is light in terms of the cost to go into college.
Right.
But we are very affordable if you compare us to other schools of nursing across the
That's
state.
what I was going to say. If you take that comparison level, and that's what I was trying to allude to at the beginning, the comparison level of other schools, UTMB is the best. It's actually, it's registered as one of the best values of an education here too, because of the return once you're in the workforce there. And of course, always those of you out there hiring nurses and stuff, you should pay them more, right?
That's
We're
right.
all for that. It's saying here
Right.
too. What other topics do we need to be finishing up on here today? But I know we talked about tons of stuff last Monday. We've addressed a lot here today. What is the one thing you, outside of, we have an award-winning online program, which we programs over here, but what is the one thing you want folks to walk away after watching the show today of about nursing?
For me, I would love for nurses in particular to think ahead, think broader than just what's happening today with their career, because nurses have so much to offer. And I find in working with students now for decades, they have a hard time envisioning themselves doing something. But if you then talk to a nurse who's been around as long as I have, for instance, they'll almost always tell you, I'm doing things I never envisioned that I would do when I was in my basic program. So my advice and encouragement to nurses is think big, think broad, think about your career, think about ways you could work with patients, for example, that you could never even dream of right now. Because we can't even predict the future, but we know that there's going to be one for you if you advance your career through your education.
Yeah, and one of the things too, by UTMB, I should point out, you could be a nurse in space. There's an actual program. There's an actual program here at UTMB. It was just popping in my head. You could be a nurse in space.
Or Antarctica.
Well, in fact, the polar team just walked by us here just a little while ago too, and that's another fascinating. I always tell folks about telehealth. I mean, again, UTMB groundbreaking, but for you as the dean of the School of Nursing here, what do you see? What do you think is the most important thing you want folks to get from this program?
Yeah, so we talked a lot today about the clinical degrees and starting entry-level nurses as well as the nurse practitioner degrees. What we didn't touch on are the nurses who are nurse scientists. So our doctoral degrees, our PhD degrees, our DNP, which is the practice doctorate degree. We have all of those with 13 tracks within the school. And our School of Nursing are very proud too that we have quite a few nursing scientists. And this year we're ranked in number 38 in funding, research funding from the National Institutes of Health. And our nurses are focused on, our scientists are focused on areas like population health areas, aging, community, dementia. So they're doing quite a bit to be able to help the community and to be able to help science move forward. So I would echo what Dr. Nibert said. If you're thinking about a career in nursing, yes, recognize that there are so many opportunities for you. You may not even know where your path may go, but starting in a career of nursing is so rewarding. There's so many things that you can do. Nurses are everywhere. Nurses practice everywhere. You will, as we just said, not only the geographical locations, but also the different variety of healthcare settings or variety of settings. Legal offices, we have JDs, nurse JDs are on our faculty. We have nurses that are in health policy. We have nurses that are in the C-suites. So It is a very rewarding career. I have no moments of regret of going into the career. Never knew that my career would go where it has, but I'm so very grateful that I chose nursing. We're a very collaborative profession, and we do this together. And I think our entire nation, our entire state, we need to have more nurses who are ready to collaborate, ready to lead from wherever they sit, and to work very well with our other health professions to ensure that we have a healthier community.
Yeah, and there is those opportunities you were talking about, particularly in the population side of things, that studies and the research. I mean, particularly too, we can't underestimate how the research is going to kind of, I think, boost up even more so with Dr. Reiser here now, because that is a big thing for him. And he said, because it all comes around, it's all encompassing that happens here. And so thank y'all for both being on. I mean, it's just been, listen, I could keep going all day, but your alarm keeps going off. So I got you got somewhere to be. I'm just kidding you, Dr. Jones.
We're better.
So Dr. Ainslie Nibert, she is the chair for graduate studies at the School of Nursing. Thank you for being on with us here today. Dr. Deborah Jones, she is the senior VP and the dean of the School of Nursing, and also there's chief integration officer too. I got to make sure I get that title in. And then also thanks to Diana Majerus, and good luck to you on she's taken her test. Certification test here too, after getting the online course here. And she hadn't seen her on camera because she's afraid to be on camera here today. But also Dr. Samantha Myro has been here with us. She's making sure we're behaving ourselves and talking about the subjects, and she's She's the manager of communications and strategic initiatives over in your office over at the School of Nursing as well. So thank y'all for being on today. We appreciate it. It's a fascinating subject. Again, if you're watching this on the replay here on Pod Now, we've had links that are on our Pod Now you can go through as well. That click on those, research some more. You know, somebody that just has an interest in healthcare. This is a great way to go into. A lot of times, folks, I want to be a doctor. Trust me, this is a rewarding career as well. And when you're talking about dealing with higher up Texas and that mentorship that students, one of the things is while those students at those high schools are getting a lot out of it, those mentors may get some out, and that's the recruiting of they're teaching there a little bit. Some fed, see,
That's
you got
right.
a little
I
something
didn't
going
mention
on
that
over
too
there,
much.
don't you? I figured that's what y'all were up to there.
That's right.
Thank y'all both for being on with us today. Again, thanks to Diane and the whole crew for putting this together. We haven't gotten our topic picked for next month yet. I have a sneaking suspicion that Dr. Janit's going to be around here at some point next month because he's already been calling. He's one of our favorites to have on the show as well. But we'll be back with you next month as well. I'm TJ Aulds, I-45 Now, and Pod Now.